Hi everyone. So I'm going to be presenting on the case study of Jacklyn, and Jacklyn is being referred to our prenatal clinic because she is 4 months pregnant, and the reason she was recommended to be assessed by the BHP is because she indicated that she has been drinking daily during her pregnancy, and so they wanted to provide her some extra help. So, upon assessing, Jacklyn has the following social history. She's a 23-year-old white female, is 4 months pregnant. She has an associate's degree and works full-time in a stressful customer sales position. And she lives alone in an apartment close to her parents and has close relationships with her aunt, mother, and cousin. She has no legal history other than minor traffic violations and no history of trauma. She has been drinking 1 to 2 drinks daily for the last year, and during weekends, about 4 drinks. Jacklyn says, I know I shouldn't, but I get so stressed about life and I just don't know how else to relax. She frequents a couple of clubs and bars on the weekends with her close friends or a few coworkers, as well as a couple family members who she might go to dinner and drink with. So her presenting concerns are significant stress about work, finances, and becoming a parent. She has symptoms of feeling on edge, feeling nervous, difficult sleeping, irritable with colleagues, and clenching her jaw even when doing random things like driving. She has a hard time quitting her drinking, but wants the help. She's also fearful of being stigmatized as a bad mom or an alcoholic, which is something to keep in mind when assessing pregnant women that they may be reluctant to share about their drinking. So because women can be reluctant to share about drinking, face that extra stigma, we can administer the tweak test. So this is an alcohol assessment developed for women who are pregnant. And the reason is because men are more likely to be given the cage screener or the mass test because it was developed for men's drinking patterns rather than women, especially pregnant women. So based on these answers, Jacklyn says she has a drink tolerance of 4 and that a couple family members are worried about her, maybe a couple that weren't drinking with her, and that there has been an instance where she hasn't remembered the night before after drinking and she does want to cut down. And so the way this is scored is the T and the W are 2 points, and the E, A, and K are 1 point. And a 2 point indicates a positive risk for drinking when pregnant. And so in this case, Jacklyn would score I believe it would be a 3, or sorry, a 4. So the W would be 2 points, and then the A and the K would each be a point. And another assessment tool we can give her would be the perceived stress. And this one, the perceived stress screener, is the 10-question version, and it would help us find out if Jacklyn is experiencing some significant stress in her life. This isn't used to diagnose anxiety per se, but can still be a helpful indicator. So in this one, Jacklyn has scored a 22, which would indicate moderate stress, which is a 14 to 26 is moderate, 0 to 13 is mild, and a 27 to 40 is high perceived stress. And then we would also administer the GAD-7 for anxiety. And in this case, she has scored a 14, and a 0 to 4 is minimal anxiety, a 5 to 9 is mild anxiety, and a 10 to 14 is moderate anxiety, and 15 to 21 is severe anxiety. So she's experiencing moderate anxiety, kind of almost in that realm of severe. And so my diagnosis would be the generalized anxiety disorder, because she has been experiencing these symptoms before pregnant. Okay, so these are not symptoms of her pregnancy, which is important because pregnancy can cause fatigue, it can cause muscle aches and difficulty sleeping. So we want to track that these symptoms happen before the pregnancy, which in Jacklyn's case it has. And it's also occurring in a lot of areas of our life, not just the pregnancy or work. So this isn't an adjustment disorder, but an actual anxiety disorder. As she indicated, anxiety about finances, her pregnancy, her job, and even a couple relationship issues during the assessment. And she reports that she has, like we said, the feeling on edge, the fatigue, the irritability, and the muscle tension. In addition, I would give Jacklyn an alcohol use disorder with the mild severity. And the reason for this is because she is feeling significant distress about her drinking. She is consuming more than she wants. She is having a hard time cutting back alone, and she feels the urge to use alcohol after work. And so these are indicators of a mild alcohol use disorder. However, it's not moderate or severe because we don't really see this impacting her ability to go to work, or to have healthy friendships, but it is impacting her health and her baby's health. And so that's why that would be the diagnosis. So the members of the integrated care team, we would have the OBGYN who would monitor her pregnancy and kind of share any concerns with the BHP and the PCP and provide all those testing and provide even some education on how to care for her and her baby. The social worker would be able to provide the brief treatment, whether that be the brief substance use treatment or the brief CBT treatment, which would be Jacklyn's recommended treatment. The PCP can help Jacklyn track her overall health during the pregnancy as well, and kind of collaborate with the OBGYN and BHP on treatment goals. And I would also include the nutritionist who could be a helpful person to introduce Jacklyn to a healthy diet while pregnant, especially as she's tapering off the alcohol and make sure she's getting the needed vitamins and the prenatal vitamins. And I also have a little arrow going to the Kern County Behavioral Health and Recovery Services because this would be a specialty mental health provider in the area that we could recommend for Jacklyn if her alcohol use were to continue, if she couldn't get sober, or if her anxiety was worsening to a more severe state. So her treatment goals would be to practice the CBT skills to reduce her stress, as evidenced by lower PSS scores from 22 to 14 in the next 4 weeks. And we're also hoping that that would help her with the cutting down with alcohol as well, because alcohol can be related to stress and anxiety and even be self-medicating. We would want to see her reduce her drinking consumption from 1 to 2 drinks daily to 0 drinks over the first 2 weeks of treatment. So, because she has a mild disorder, she might be able to actually jump right into abstinence. And we would want to do that as quickly as possible for her and her baby's safety and their health. And then Jacklyn will also participate in alternative community activities with members of her social support system that do not involve drinking at least once weekly for the next 2 months. And the reason is that this is a significant part of Jacklyn's life, her support system, which unfortunately is involving drinking. So by finding other activities, it can help her reduce stress. It can help her feel a greater sense of connection. And that could in turn reduce her anxiety and keep her support system, which is important as she is going to be a single mom. At least for the short term. And then the progress monitoring. So I will administer the PSS to monitor progress monitoring. The PSS 10 has actually better psychometric properties to the PSS 14 for reliability, and it is an easy to administer test. So this is a well-known test that can help track her stress. And then I would also administer the GAD-7 to monitor her anxiety. And there was a study of 5,030 subjects in Germany where they found that the validity and reliability of the GAD-7 is supported for the general population across different cultural and ethnic backgrounds. And then Jacklyn will also create a drinking diary, which Hunter recommends as a brief treatment intervention, but can also help us monitor how many drinks she is consuming each day as long as she's being honest, which means we need to create an environment that isn't stigmatizing and that is empathetic and accepting for Jacklyn. And then the data collection timeline and analysis plan. So I would administer the PSS every 4 weeks. So it is kind of administered on a monthly basis. And the goal would be to see the score decline at least 7 to 10 points by her 6 month of pregnancy and to see sustained progress for the last 2 months, if not it decreasing further. My reasoning for these numbers is in a study of pregnant women who have faced infertility. Participants received weekly CBT sessions, and their progress was tracked by using the PSS 14. So, as we know, the PSS 10 is a little bit better than the PSS 14, but their mean score did go down from 46.5 to 38.9 after 4 weeks. So, we would want to see kind of a similar thing in Jacklyn, who is also pregnant, even though she hasn't faced infertility, to see it decrease by maybe like 6 to 10 points or 7 to 10 points. I would also monitor her progress by administering the GAD-7 every 2 weeks during her pregnancy. unless the score is diminished to less than a 5, which in case would indicate that there wasn't anxiety anymore. And then if that happens 2 assessments in a row, then maybe we would consider reducing Jacklyn services and doing like check-ins instead. In a study of 261 patients who were given the GAD-7 at baseline week 12 and week 14, they found that the CBT treatment did significantly decrease the scores. So this is a good monitoring for CBT treatment. And the MCID, which is like the minimal change that the patient finds valuable and when they start to feel different, was 4 points. So we would hope to see Jacklyn's score decrease by at least 4 points so that she would feel the difference in the anxiety as well. And the reason to, or the way to analyze this would be to create a graph of the visual change in scores over time, and then to also conduct a paired t-test to see if the change between, sorry, the pre-test score 1, which would be baseline, is significant to the post-test score 1 at every interval or testing. So we could do this after every 2 weeks or after a month, or even at the end of treatment when maybe after Jacklyn has her baby. And again, we could continue this after Jacklyn has her baby, but we would want to keep some other things in mind, like possible postpartum depression and things like that that might need different measurement tools. So anyway, thank you for joining me. These are the references that I used, and I'll look forward to reading your guys' discussion boards.